thank you so much, Nina, for coming on to the podcast. How are you today?
I'm great. Thank you very much for having me.
Oh no, it's an absolute pleasure. So your area of expertise is in the area of integrative medicine, and I know many people know what that is all about. But for those who don't know, would you be able to just explain a little bit about that area and what it involves and it entails?
Sure. So, to me, integrative medicine is a rational, careful, and effective use of multiple modalities. It is marrying the best of conventional medicine with nutrition, lifestyle medicine, and evidence based complementary therapies in a way that is personalized to the patient and delivers them the health outcomes they need.
We don't have the time necessarily potentially to be able to sit somebody down and say, look, okay, I think these are the potential reasons why you're coming back to hospital every 2-3 weeks, and let's see what we can do to eliminate this potential root cause. And I think that's why looking at the person in a holistic way, in a functional way, is really, really useful, because then you think, okay, let's get rid of these potential root causes, so that you don't have to come into hospital, you don't need to come into hospital, or this chronic problem is eliminated, which can be done through, lifestyle, nutrition, exercise, good sleep. The other thing is, though, probably people, many people don't necessarily believe in this area. And I would say one of the reasons maybe is that the lack of evidence, or maybe evidence is out there, but people don't know about it. Would you want to talk about that a little?
Definitely. I think perceived lack of evidence is how I would describe it, because the evidence is definitely out there for a large variety of lifestyle interventions in terms of what it can help. Certainly in cancer, I mean, saying that diet doesn't matter in cancer is a non-evidence based statement. There are so many trials. There's the World Cancer Research Fund report on the fact that your lifestyle definitely matters in cancer risk, supported by thousands of studies. So we just can't say that. You can't say that diet doesn't matter or nutrition doesn't matter. We can't say movement doesn't matter, because it definitely does. Even simple things like sometimes we can actually use specific interventions to even affect the toxicity of some medications. So, for example, as well as things like risk of recurrence. So a simple intervention like a prolonged nightly fast of 13 hours plus can reduce the risk of breast cancer recurrence. Giving lapatinib, like tyrosine kinase inhibitor, after an overnight fast rather than at another point in the day reduces the risk of toxicity like diarrhea and rash by doing a simple change. So the evidence is definitely out there, and it's measurable and it's clinically significant. It's just that as doctors, we get minimum of education in nutrition. You get lucky if you get 2 hours in medical school, and that's it.
That's
Bye-bye.
lucky if you get 2 hours. I don't think I remember getting any nutritional
I got two
lectures at
hours,
all.
all about calcium and vitamin D for bone health, and that was it. That was ta-da! You're done. I was like, oh, and sorry, and obviously Wernicke Korsakoff's and alcoholic stuff for B1. That
Yes,
was it.
yeah,
That was my extent of my nutrition education at
yeah.
university. But so I think that's one of the problems. The problem is that doctors don't feel comfortable talking about it because we don't have enough education. And luckily, there are organizations such as NutriTank who are helping to change that and actually get more medical education to bring in nutrition as a part of the medical curriculum. The other thing to say is that quite often lifestyle is viewed as a soft option. And actually, I'm like, there is nothing more powerful, literally, than lifestyle. And also nothing that's more invasive, because it's something that you have to do every day and you have to choose to do.
Yeah.
Medication you can take, it doesn't really, beyond side effects, it doesn't actually affect you that much. Surgery, you go in, you have surgery, you come out. But lifestyle you have to do and you have to choose to do to a certain
Yeah.
degree. So it can be also tough, and people maybe and healthcare professionals might always have the toolkits like motivational interviewing to be able to get patients to take that up on board as well. So it's, I think, a multifactorial problem. One is the fact that actually we're not really that comfortable talking about it as doctors because we don't have necessary education unless we went out and got some extra education. Number two is actually that we might not be that well equipped, we might not have enough of a team setting around us to be able to deliver the motivational bit that goes with it to enable implementation and avoid frustration on all sides in terms of the what you are saying being implemented. And the third bit is that lack of awareness of the need to do a holistic assessment, like you talked about. It's actually the fact that most of the time we don't ask the right questions, and therefore we can't get to the bit that's going to be a big pressure point for that person. So I think for me, those are the three things that we need to tackle. The evidence is definitely out there. And I think, you go to PubMed and type in nutrition and your disease of choice, and you can lose yourself for days, quite literally, in reading the evidence. And in cancer, it's a huge thing. And it's not just about the typical things that we talk about, like cachexia, which is, again, managed pretty poorly nutritionally because people still think it's a calorie problem, and it's just not. I mean, the evidence is it's not. It's a significantly catabolic inflammatory state, and so pouring more sugar down people's throats is really not going to help. And guess what? That's exactly what we found out in outcome studies, because cachexia is very poorly treated. So to me, I think we need to think broader, and we also don't need to pile all of this on the treating clinician, because we can't expect you in clinic, Tasha, or a clinical oncologist to be able to deliver this. This isn't what it is about.
Yeah.
It's about having a broad awareness and openness, and then building a team or knowing who to refer to get the right input. And maybe it's a clinical nurse specialist, maybe it's the dietitians, maybe it's a group approach, because another thing that I think could be immensely powerful.
If people want to connect with you, where should they go?
So there's two ways of connecting with me. One is my own website, which is drninafullershavel.com, and that's really more for professionals in education. And if people want to come and see what the clinic is doing, then it's synthesisclinic.co.uk.
Fantastic. Well, I will leave all of those in the show notes so people can check them out if they want to connect with you. And do please connect with Nina. She's amazing, and she's got a huge amount of information to share with you. So once again, thank you so much, Nina. Really appreciate your time, and hope to catch up with you soon.